Hello, YouTube. Thank you for joining me. This is Dr. Erica, pharmacist, uh, owner and founder of Millennium Pharmacy. Please like, share, and subscribe if you haven't already. I'm talk about in this particular video, Xelstrym dextroamphetamine patch, which is a 9-hour patch every 24 hours or every day. You're going to apply 9 hours worth of the patch. Okay, so when you apply to the area, you want to make sure the area is clean and you want to make sure the area is completely dry. Now, there are several areas that's recommended by the manufacturer of Xelstrym, which is called Novum Pharmaceuticals, and they suggest that you apply the patch on the top half of the body. That includes the hip, the arm, the stomach area. So do be aware of those particular locations that are specific for application for this particular patch. The patch is very clear and the patch is in 4 different sizes depending on the strength of the medication that you're going to be prescribed, okay? So that's include again the upper back, the chest, the upper arm, the hip, and the flank area. Is those going to be the locations where you're going to apply the Xelstrym patch for 9 hours. And as you know, dextroamphetamine is a mental stimulant for ADHD for patients who are adults and also for pediatric patients who are of the age of 6 years and over. That is the indication for the Xelstrym patch. And it is found online. And then there are also coupons that are available as well for patients who don't have the particular prescription insurance coverage for it. GoodRx is a great choice for coupon reduction of pricing. So do check it out. Now, most dextroamphetamine products are expensive. Out of pocket costs is very high. I would recommend, in order to save, that you receive a voucher or you receive samples. Also, you might want to consider um, government insurance if possible. Okay, so again, some of the side effects I'll go over towards the end of the video, but do remember that it's for ADHD only. It is a mental stimulant in adults and children 6 years of age and older. Now, it also is very discreet. There's no color to it. You just apply it for 9 hours, take it off, and you continue on with your day. And you're going to do that every day, every consecutive day, not missing any days. Okay. Now, some of the side effects are going to be like decrease in appetite, also headache, insomnia, or lack of sleep. And then there's also going to be a psychological and physiological dependence with the patch because it's going to work in the brain and produce the euphoria, the stimulation. The body is going to become more and more dependent upon that. And so the body is going to become accustomed to that. Okay. So people who have utilized dextroamphetamine products as children, as adolescents, and young adults continue on with the product into adulthood because they become accustomed to it. Their bodies become adapted to the side effects, adapted to the indication, and so the body begins to normalize itself around the dextroamphetamine component. And because this is a very first patch ever for dextroamphetamine, it's likely to be abused and detoured into the areas where it shouldn't be purchased. So we want to make sure that we are keeping them and storing them in safe locations. Keep them under lock and key. Always know where they are, and also I would maybe keep them in a stored safe, if possible, at home, away from pets and away from elderly people, patients who are cognitively impaired. I would keep them away from those particular people because they could get into the wrong hands and cause the wrong effects. It's never to be used by mouth and never to be consumed or swallowed. It's only to be used topically in the areas that I mentioned earlier, the upper torso of the body. Now, some of the side effects, again, besides dependence, is going to be an increase in heart rate, also increasing blood pressure as well, GI pain, nausea and vomiting, even muscle twitching or tick, and then irritability as well. Now, there have been some reporting of the patch itself causing irritation on the skin, such as rash, redness, and itching, and swelling and discomfort. So, do be aware of those. And you also want to make sure that you swap locations between patches. Like maybe on Monday you use the upper arm, on Tuesday you use the upper back, on Wednesday you might want to use the flank or hip area just to reduce the chances of irritability and stress on your skin. So that's my recommendation for Xelstrym patch. And also you can check with your doctor to find out if this is the right formulation for you. Some I know most of them come in like capsules and they come in tablet form, Adderall tablets and Concerta tablets as well. But if you are eligible for the patch, then you might want to make sure it's okay with your doctor first before going ahead to get a prescription. Talk with your doctor, build a relationship with your doctor, find out if that's what they want you to do for your best outcome and your best result. Okay. So that's all I had for this particular video. Thank you. And also subscribe to this channel. I'm Dr. Erica signing off. Take care. Bye bye.